Hello, everyone. Welcome to Healthy Futures focus area for RSVP. First, I'd like to go over a few housekeeping items. Please use your computer speakers for audio. If you're having a hard time hearing me, please check to make sure that your speakers are turned up. Also, you can select closed captioning. It's available on the left-hand side at the bottom. If you have a question, please click the green Q&A button on the lower left-hand corner of your screen. If you have a technical question, that will be answered by campaign consultation, but we will answer any content questions throughout the presentation. We have a few designated times, but feel free to submit questions throughout. We will also collect all questions and answer any that we don't get to in the forum. You can access the forum, once again, on the bottom left-hand side of your screen under Content. And also within the Content section, you can access files, and that will also have the PowerPoint if you'd like to access the PowerPoint. Over the next half hour, we are going to review 3 work plans to decide if they can be adapted to align with the new Healthy Futures performance measures. Using the RSVP performance measure instructions found in the RSVP competition NOFO Appendix B, we will explore how current volunteer activities can demonstrate impact in Healthy Futures. Finally, like I said, there will be time for question and answer. The Healthy Future focus area notes that grants will meet health needs within communities, including access to care, aging in place, and addressing childhood obesity. Grant activities will increase seniors' ability to remain in their own homes with the same or improved quality of life for as long as possible, increase physical activity, and improve nutrition and use with the purpose of reducing childhood obesity and increasing access to nutritious food, and improve access to primary and preventative health care for communities served by CNCF-supported programs. An RSVP project would like to identify Healthy Futures as their primary focus area. They have a total of 800 unduplicated volunteers. Using the RSVP performance measure instructions, we're going to review 3 current work plans and determine if they are a fit. Now, we're not looking at the language to ensure that it specifically fits. What we're looking for is trying to determine if we can adapt it to fit with the new performance measures. First, we're going to explore Strategic Plan Objective 1 for Healthy Futures, Aging in Place. The outputs for this measure are H8, the number of homebound or older adults and individuals with disabilities receiving food, transportation, or other services that allow them to live independently, and H13, the number of caregivers of homebound or older adults and individuals with disabilities receiving respite services. The first work plan we're going to review is one in which RSVP volunteers support older veterans living in 4 wards of the George Washington VA Medical Center. The current output that the RSVP program has is veterans aged 55 and over will receive daily visits and support from RSVP volunteers. The current outcome that the project is using is that 75% of participating veterans will report they feel less depression. Once again, the current output is 150 veterans aged 55 and over will receive daily visits and support from RSVP volunteers. The Healthy Futures output measure is the number of homebound or older adults and individuals with disabilities receiving food, transportation, or other services that allow them to live independently. So now we're going to do a poll, and once again I remind you that we're looking to see if it can be adapted to fit. Using the poll, please tell us what you think. Does this work plan align with the output measure H8? To review, the current output is 150 veterans at the VA hospital will receive daily visits and support from RSVP volunteers. The Healthy Futures output measure H8 is the number of homebound or older adults and individuals with disabilities receiving food, transportation, or other services that allow them to live independently. So I'm going to wait about 15 seconds, and then we're going to explore some definitions to see what the answer is. Okay, and we're going to move on, and if you have already answered the poll, you can close it by clicking clicking close on it to see the next slide. So we're just going to go over some definitions to explore whether this work plan can fit with the specific measure that we're discussing right now. Once again, Measure H8 uses several terms. They use the term homebound, individual with a disability, receiving food, transportation, and other services, and live independently. Let's explore the meaning of these terms. Homebound, individuals unable to leave their personal residence due to disability, injury, or age. It may be a short-term or a long-term need. For example, an individual may have broken a hip that prevents them from driving for a few months, but after the injury has healed, they no longer require help to live independently. Next, individual with a disability is an individual who has a physical or mental impairment that substantially limits one or more major life activities, has a record of such an impairment, or is regarded as having such an impairment. Receiving food, transportation, or other services, the individual should receive the support needed to maintain independent living. Not all individuals will require the same supports. This may include food deliveries, legal and medical services, nutrition information, transportation, etc. And finally, the definition does include the term live independently. Individuals live in a private residence, house, apartment, mobile home, rather than an assisted living facility, nursing home, or group home. So according to the poll, we're pretty equally divided. About 50% of you think it can fit, and close to 50% think that it can't. So let's explore what the answer is. Based on the specific measure that we're looking at, no, it does not fit aging in place. So let's explore why it doesn't fit aging in place. First, the definition of homebound includes individuals unable to leave their personal residence. The clients served in this case are in institutions, not a personal residence. Second, the definition of receiving food, transportation, or other services includes the statement that individuals should receive the supports needed to maintain independent living. The activities in this example are not fostering independent living. Third, live independently is defined as individuals live in a private residence, house, apartment, mobile home, etc., rather than an assisted living facility, nursing home, or group home. So right now, I think we're going to pause for questions. So if anybody has a question, they can submit it, like I said, using the green button on the bottom left-hand side of your screen that says Q&A.
And I do have some questions coming in. The first one is, does the independent living work plan apply to homebound or older adults or individuals with disabilities? Or does it apply to homebound or older adults with disabilities and individuals with disabilities?
Okay, that's a good question. Yeah, the language can be a little bit confusing, so let's explore that a little bit. When it says, I think the definitions kind of clarify. It says homebound includes individuals unable to leave their personal residence. But then I know the work plan or the measure does say something about or older adults or individuals with disabilities. But I think the other definition to explore in this case is the definition of receiving food, transportation, or other services. At the conclusion, it says the activities in this, it says individuals should receive the supports needed to maintain independent living. So if somebody's in a hospital and where they're most likely to remain until they pass away, it's not really fostering independent living. So it wouldn't meet the definition of receiving the food, transportation, or other services that enable them to live independently.
Great. And another question is to please define older adult.
Please define older adults. I don't think it's limited to older adults. So if we look at the measure H8, because I don't think that definition is included in our instructions, but if we look at the measure H8, the number of homebound or older adults and individuals with disabilities receiving food, transportation, or other services. So, we're not limited to serving just older adults. So you could have an individual with a disability or that has been injured that needs some assistance that will help enable them to stay in their home and live independently. So I don't know that that definition is all-inclusive. But I would assume older adults refers to 55 and older.
Okay, and should we do one more question?
Sure.
Do older adults living in an independent living residence, not assisted living, qualify?
That is a good question, and I'm going to take note of that, and I think we'll get back to you and answer that in the forum. Okay, so I think we can move on. And again, we will have more time for questions later on. And like I said about the question that I just received that I want to look into before answering, we also will be answering questions in the forum. Okay, so as we discussed, this activity does not align with Healthy Futures. One option for the program would be to include the work plan in their community priorities. And please note also that the program can report on veterans served in the demographics section of the progress report and in the annual progress report supplement. Next, we're going to review the Healthy Futures Strategic Plan Objective 2, Food Security. The output measures within this work plan are H10, the number of individuals receiving emergency food from food banks, food pantries, or other nonprofit organizations, and H11, the number of individuals receiving support, services, education, and or referrals to alleviate long-term hunger. The corresponding outcome for food security is H12, the number of individuals that reported increased food security of themselves and their children as a result of CNCF-supported services. So the work plan we're going to explore is a project that is serving at 3 community garden locations where they register, train, and support participants in the garden. They have 65 unduplicated volunteers serving in this area. The output is 390 participants are educated on sustaining and growing healthy organic vegetables. The outcome is that 60% of participants report that the vegetables grown helps them meet their basic food needs. So once again, just kind of at first glance, we'd like to see what you think. Does the community garden work plan align with Healthy Futures measure H11? To review, the current output is 390 participants are educated on sustaining and growing healthy organic vegetables. Does this fit the output measure, number of individuals receiving support, services, education, and or referrals to alleviate long-term hunger? I'm just going to give it a few seconds. Okay, and we're going to move on to the next slide to explore some definitions to help us answer this question. Once again, if you've already answered the poll, you can close the poll so that you can view the slide. To determine whether this work plan aligns, we'll review the corresponding definitions that can be found in the performance measure instructions. Long-term hunger refers to the USDA's definition of low food security or very low food security. Low food security, based on the USDA definition, means households reduce the quality, variety, and desirability of their diets, but the quantity of food intake and normal eating patterns were not substantially disrupted. And very low food security means at times during the year, eating patterns of one or more household members were disrupted and food intake reduced because the household lacked money and other resources for food. So according to the poll, a large majority of you did think, I did close the poll, but from what I remember, did think that the correct answer is yes, and you were right. Well, you know, it does need some work. This work plan can be aligned to fit with the definition. If the data collection tools demonstrate the population being served is experiencing low or very low food security, then this work plan can be adapted to align with Healthy Futures. So, moving on, if the project does choose to continue with food security measure H11, there may be an option for an outcome pairing. So if they want to make this an outcome work plan, let's look at how they could work on aligning that. The project's current outcome is 60% of participants report that the vegetables grown helps them meet their basic food needs. The appropriate outcome, H12, is the number of individuals that reported increased food security of themselves and their children as a result of CNCS-supported services. So I think everyone kind of determined through the poll, and we've kind of realized that with some adjustments, this work plan could report an outcome associated with its output. The new work plan for this Healthy Futures measure would read an output of 390 individuals receive services to alleviate long-term hunger. The new outcome would be 234 individuals report increased food security as a result of CNCS-supported services. Now, another change to kind of note here is that the program changed the outcome from a percentages reporting to a number. And that's another little change that programs will make when they're aligning with the new measures, is oftentimes they've been reporting on percentages, and they'll just need to make the switch to numbers. Moving on, we're going to explore Strategic Plan Objective 3, Healthy Futures Access to Care. And there are 3 corresponding measures within access to care. There's H2, the number of clients to whom information on health insurance, health care access, and health benefits programs is delivered. H4, the number of clients participating in education programs. And H7, the number of clients receiving language translation services at clinics and in emergency rooms. The project thinks the current activity that they're working on may fit output H4, the number of clients participating in health education programs. The service activity is RSVP Bone Builders exercise trainers will provide twice weekly 1-hour strength training and balance classes free of charge to participants in the 2-county area. The current output is 800 participants will attend Bone Builders classes weekly for the 12-month grant period. The current outcome is 75% of participants will demonstrate improvement in strength, flexibility, balance, socialization, and well-being. So now we're going to do another poll and see if you think that the Bone Builders work plan can align with Healthy Futures measure H4. Again, the current output is 800 participants will attend Bone Builders classes weekly for the 12-month grant period. Output measure H4 is number of clients participating in health education programs. And as we've done for the other work plans, we're going to look at the performance measure instructions that are located in Appendix B of the NOFO and look at some definitions and make sure that we can align this work plan. And again, you can close the poll if you've already responded. See, and the definition we're going to look at is health education program. And a health education program is defined as any planned combination of learning experiences designed to predispose, enable, and reinforce voluntary behavior conducive to health in individuals, groups, or communities, and/or an educational process by which the public health system conveys information to the community regarding community health status, healthcare needs, positive health behaviors, and healthcare policy issues. So as we can see in the poll, once again, the majority agreed that this can be aligned to fit the new measures. And the correct answer is yes. So 83% of you got that right. And the measure H4 is an output measure, so there is no outcome pairing that the project could explore. So before we move on, I just want to pause for questions again.
Okay, our first question, one second please. Well, just one note, older adults definition is 65 and older, going back to the previous question.
Oh, thank you, Tara.
Sure. The next question is this measure limited to families with children, or can it also apply to older adults? And this was with regarding the last work plan review.
Okay, let me refresh my memory. We were talking about the community gardens. Is that what it's referring to?
Yes.
Yes, this applies to Let's review the definition again. This applies to the healthy features in terms of access to food. This applies to families or households, and you count each individual in a household, including adults and children.
Thank you.
So this is not limited to children.
And do soup kitchens and food pantries also align with H11?
Good question. And I want to confirm an answer to that because I think it kind of just depends on the clients they're serving, because the goal is to alleviate long-term hunger. So, for example, the community gardens are teaching them how to grow healthy vegetables and in turn educating them and moving them towards food security. So presumably those going to food pantries might not necessarily be reaching food security quite yet. So I think that in terms of alleviating long-term hunger is what complicates this. So what I'd like to look into is the rest of the measures and see if there's an opportunity to fit in food pantry somewhere and what that would look like. So we'll address that in the form.
One other question. If we report numbers instead of percentages on outcome, would that mean that we should survey all recipients?
There is a data. Oh, sorry. Go ahead.
I was just going to say it goes on to say that this project does survey a sample of beneficiaries, but they wanted to know if they needed all of the recipients to answer the survey.
Mm-hmm. There is a session, I think it's available on demand, on actually collecting data, and I think that would be the best session to view in terms of how to collect the data to support these measures, but I can also follow up and include that in the form.
Okay, great. I think that will be all for now, and we'll continue with the questions later in the presentation.
Okay. So we're going to move on to review the project plan. And note, this is going to reference some of the percentages that are part of the new performance measure requirements. So hopefully there's no confusion, but this kind of assumes that everybody's reviewed the RSVP performance measures module that was available before the conference started. But please do feel free to submit questions if you have some. We learned that the first work plan at the VA Medical Center is not in the healthy features and will be included in community priorities. And they have 75 unduplicated volunteers serving at this station. And again, unduplicated volunteers is a very important part of the measurement for the new performance measures. You can only report each volunteer on one work plan. Next, the community garden work plan does align with healthy features and can also be used as an outcome work plan. And they have 65 unduplicated volunteers serving in the community garden station. And then the Bone Builders work plan also aligned with healthy features, and they have 200 unduplicated volunteers. So let's see what that looks like percentage-wise. The project's primary focus area can be healthy features. Their total number of unduplicated volunteers is 800. And between the Bone Builders and the community gardens, there are 265 unduplicated volunteers in healthy features, or 33% of the project. This meets the 25% requirement for a primary focus area. The VA is the project's only other community priority, and with 75 unduplicated volunteers, it represents 9% of the project. This is well within the allowable range for community priorities. Community priorities can be as high as 30%, but it's okay to be below this percentage. And finally, we didn't review their other work plans, but using the performance measure instructions, the project found that the program is able to adapt their remaining work plans to fit measures in the other focus areas and capacity building, which represent the remaining 58% of unduplicated volunteers. So now that we've gone through kind of a sample project plan or a little bit of a sample project plan, please submit any questions through the chat function. We have about 5 minutes to answer questions.
Okay. We do have several questions regarding congregate meals. Will congregate meal service be an acceptable activity within this focus area?
It will not. There is a frequently asked question, and it specifically states that congregate meals would be in community priorities, which can be 30% of your project.
Another question is, would you put the activity Veterans at the VA in community priorities rather than Veterans and Military Families focus area?
That's a good question, and the program could explore whether they can fit it within the Veterans focus area. And if you're curious about that focus area, there is an on-demand session. It's also slated for 4 o'clock today on other community priority, on the remaining focus areas, and it actually goes through and explores what can be included in Veterans as well as the other focus areas.
One general question is, where can we find a comprehensive list of all performance measures that includes definitions and is not part of the online learning module? They're asking for a printable list.
Okay. Yeah, that would be the, because this module that we've gone through is not all-inclusive of the measures, and we didn't explore every single definition. So that can actually be found in the RSVP NOFO, and it's the Appendix B.
Thank you.
And if that NOFO isn't available somewhere, I can see if we can make it available in the files section.
Great. And if a volunteer is counted in the primary focus area, in terms of unduplicated volunteers, can they be in any other work plan, for example, in capacity building?
No. So each volunteer is counted only once. So they can definitely serve in other areas. But what projects will want to do is kind of strategically determine where they can show the most impact for their volunteers. So for example, if you have a project that's serving veterans, but also could fit under healthy features, then you might want to keep it in healthy features, because you can also report on the veterans in the progress report. There will be a separate section in the demographics for reporting veterans served. So you'll kind of show more impact if you keep it in the primary focus area. So in terms of, if you have 100 volunteers, only 100 volunteers can be represented in the entire work plan. If we added it up and it showed more than 100 volunteers, it would be incorrect.
Okay, we do have several questions coming in, but we just have time for one more before we move on to the next section. This is a bit specific, but if volunteers are visiting people in hospitals who intend to go home to live independently, could that be acceptable in the first example?
No. Because they're not at home. But if there's any follow-up on that, please put it in the forum.
Yeah,
okay. I think
many questions.
Okay. Pardon?
There will be many questions in the forum.
Good. And I anticipated a lot of questions. This is just kind of the tip of the iceberg in terms of the measures, and as we know, RSVP has a lot. So I really appreciate everybody's participation and your great questions, and I look forward to kind of digging into them a little bit more in the forum. But right now, we are going to move on to another important focus area. We're going to move on to the focus area in education. And I'm actually going to go over housekeeping one more time, so forgive me for those that were already on here, but I anticipate that some people might have joined just to listen in on education. So just first, again, please use your computer speakers for audio. If you're having a hard time hearing me, please turn them up. If that doesn't help, closed captioning is available. Click it on the left-hand side of your screen. On the bottom, it says CC. If you have a question, again, please submit them through the chat function through the Q&A button on the left-hand side. It's a green button on the left bottom corner. And we will have time for questions throughout the remainder of the presentation and also a few time for Q&A at the end. And also, if you click on the content button, that is where you will access the forum. So we are collecting questions, and we are going to revisit questions that either we are unable to answer due to time or that we need to look into further. And also, you can make the screen bigger by clicking on the bottom right-hand side of your screen. There is a little box with arrows pointing outward, and if you click on that, you will make the screen bigger for you. And so over the next half hour, we are going to review 2 work plans to decide if they can be adapted to align with the new education performance measures. Again, we're going to be using the RSVP performance measure instructions, which are found in the RSVP competition NOFO Appendix B. We are going to explore how current volunteer activities can demonstrate impact in education. And again, there's going to be time for question and answer. The education focus area states that grants will provide support and or facilitate access to services and resources that contribute to improved educational outcomes for economically disadvantaged people, especially children. Grant activities will improve school readiness for economically disadvantaged young children, educational and behavioral outcomes of elementary, middle, and high school students with special and exceptional needs, and the preparation for and prospects of success in post-secondary education institutions for economically disadvantaged students or students with special or exceptional needs. Now, once again, we're going to go through an exercise and explore a work plan to see if it can be adapted to fit within the new performance measures. The current RSV project has identified education as their primary focus area, and they have a total of 185 unduplicated volunteers. And like I said, we're going to review 2 work plans to determine if it fits. The RSVP education focus area of K through 12 success has 2 output measures and 4 outcome measures. The first measure the program would like to explore is ED4A, as seen in bold on your screen. It is the number of disadvantaged youth mentor matches that were sustained by the CNCS-supported program for at least the required time period. The service activity that the program thinks will fit with ED4A is RSVP volunteers will serve at an after-school program as mentors and tutors for at-risk children. The current output that they're using on this work plan is 65 at-risk students will be mentored and tutored by RSVP volunteers after school. And the current outcome is 60 students will be promoted to the next grade in school. So does it fit K through 12 success? Once again, the output for this measure is the number of disadvantaged youth mentor matches that were sustained by the CNCS-supported program for at least the required time period. Now, there are a lot of definitions to explore within this particular measure, so we're going to move on and explore the definitions that can be found in the NOFO. The performance measure instructions define mentors as adults who provide CNCS-sustained support to children or youth through either community-based programs or school-based programs. Programs that involve peer-to-peer support should not be included in this measure, for those programs use tutoring measures. Community-based mentorship, they're going to count mentees in those matches that are intended to be continuous with the same mentor for 2 to 3 hours per week for at least 12 months and up to 24 months. And mentoring relationships are ideally 1 mentor per child, but it could be a small group with a ratio of no more than 1 to 3. The next term that applies is disadvantaged youth, which includes those youth who are economically disadvantaged and 1 or more of the following: who are out-of-school youth, including out-of-school youth who are unemployed, who are in or aging out of foster care, who have limited English proficiency, who are homeless or who have run away from home, who are at risk to leave secondary school without a diploma, who are former juvenile offenders or at risk of delinquency, who are individuals with disabilities. It is the grantee's responsibility to ensure the beneficiaries of service meet the eligibility requirements provided in the definition. Finally, economically disadvantaged is defined as eligible for free or reduced lunch, and they may or may not actually be accessing free or reduced lunch. So we've got a lot of definitions here, but the program likely can make it work. Using the performance measure instructions, the program has identified a few ways to adapt. First, they need to specify that the mentor time commitment is at least 12 to 24 months. They need to specify that the number of children per mentor is no higher than 3 to 1. And for their purposes, they used the term at-risk children. They need to define at-risk children and determine if the children they are serving qualify as disadvantaged or economically disadvantaged. So the program, like I said, has determined that they can fit this and that the children they are serving is economically disadvantaged. So they would like to explore this as an outcome measure, and the outcome options for the selected output are the number of students with improved academic performance in literacy and or math, ED 27, the number of students in grades K through 12 that participated in a mentoring or tutoring or other education program, including CNCS-supported service learning, who demonstrated improved academic engagement, ED 6, number of youth that have improved their school attendance over the course of the CNCS-supported program's involvement with the student, and ED 26, the number of students acquiring a GED. Now, the current outcome that the program is using is that 60 students will be promoted to the next grade in school. Outcome measure ED 27 is the number of students in grades K through 12 that participated in the mentoring or tutoring or other education program, including CNCS-supported service learning, who demonstrated improved academic engagement. So the program is already tracking it based on going to the next grade, but this is actually requiring improved academic engagement, so the program can make this work. So since they've decided that this measure can align with education, the new work plan is an output of 65 disadvantaged youth mentor matches are sustained by the CNCS program for at least the required time period. And the new outcome is 60 students in grades K through 12 that participated in a mentoring or tutoring or other education program, including CNCS-supported learning, who demonstrated improved academic engagement. So right now I'm going to stop for questions. So again, submit questions through the Q&A button on the bottom left-hand side. It's a green button.
Okay, and the first question is there a way to put adult literacy tutors in this focus area?
You might want to explore some of the other education options, because the definition did seem to indicate that adults may be an option. So I think it merits further exploration, but it might depend on what the activity is. It also could be a fit depending on how the program works. It could also maybe fit within the economic opportunity focus area. So not knowing the exact activity, I can't say yes or no, but I think it's worth exploring.
Okay. And we have a few general questions also at this point. Is it correct that there can only be one work plan for community priorities, which can contain up to 30% of unduplicated volunteers? So there is the requirement that only 30% be in the community priorities. Up to 30%. And it's, as far as I understand, I'm not sure yet if it's a requirement, so I can get back to you on that in the forum, but my understanding is that it's going to be encouraged that people use one work plan for community priorities. And will the projects report hours of the volunteers only in the primary focus area? The project is going to report on unduplicated volunteers and results. Hours, I believe, may still be like in the demographics section of reports, but it's not necessarily going to apply in the work plan. So you would still, so in the demographics section, I think you would still report on all volunteers. And are you required to have a work plan for all 6 of the primary focus areas in your grant? No. So the program can choose, where they want to focus their grant. So each project will have to focus at least 25% of their volunteers in a primary focus area of their choosing.
And then the remaining, they have that 30% that can be in other community priorities, and whatever's left, they're going to fit into the focus areas of their choice. But no, you don't have to represent all 6 focus areas.
And just one more question, general question before we move on. Do all volunteers need to be recruited in the first year of a 3-year grant?
I am going to defer that to the form or potentially a competition question. So that may need to go to the competition area, but I'll make a note of it and maybe mention at least the email address for competition in the form. Okay.
Okay. Thank you.
So moving on, now we will review a work plan that the project would like to align with education measures and school readiness. The specific output we're going to review is ED21, the number of children that completed participation in CNCS-supported early childhood education programs. The service activity that they think will fit with this measure is that RSVP volunteers serve at Smart Start locations and work with children to support reading, language development, and socialization. The output is 40 children will be served by RSVP volunteers in Smart Start locations, and the outcome is 70% of the children involved will be developmentally and academically prepared for kindergarten. So we're going to do a poll to see what you think. Can the school readiness plan align with education measure ED21? The measure is the number of children that completed participation in CNCS-supported early childhood education programs. And the measure, the current work plan is RSVP volunteers, 40 children will be served by RSVP volunteers in Smart Start locations. Okay, while we're answering the poll, we're going to review a few definitions to help us determine what the answer to this question is. And again, with education, there are a lot of definitions to go through. The relevant definitions include children up through the age of kindergarten enrollment who are enrolled in early childhood education programs and who are economically disadvantaged children and or have special or exceptional needs or are in circumstances that limit their academic, social, or emotional development. Economically disadvantaged means they are eligible for free or reduced lunch, and again, they may or may not actually be accessing that service. Moving on to some more definitions, we have special or exceptional needs. Children who are developmentally disabled, such as those who are autistic, have cerebral palsy, or epilepsy, are visually impaired, speech impaired, hearing impaired, orthopedically impaired, are emotionally disturbed or have a language disorder, specific learning disability, have multiple disabilities, other significant health impairment, or have literacy needs. Children who are abused or neglected in need of foster care, adjudicated youth, homeless youth, teenage parents, and children in need of protective intervention in their homes. And moving on to more definitions, we have completed participation. So at the outset of the activity, the program should indicate how much time, like how many days or hours, is required in order to complete the activity. They will only count the number of students who meet that threshold by the end of the program or activity. This number will be used as the denominator for selected measures, and therefore the amount of participation should be enough to influence the results. An early childhood education program is a program in which CNCS-supported activities help pre-K students maintain enrollment in and succeed in early childhood education programs. The help that grantees provide does not need to be in direct service to the students. However, the CNCS-supported activities must provide direct support that makes the program possible. So it looks like, according to the poll, 84% of you thought that this could align with the education measures. And you are correct. If the data collection tools demonstrate the children served meet the requirements of economically disadvantaged or special or exceptional needs, then this work plan can be adapted to align with this measure. And so if the program does choose to adapt it, there is an outcome pairing for this measure. The current outcome that they're tracking is that 70% of the children involved will be developmentally and academically prepared for kindergarten. The project has chosen to change their data collection to accommodate the new outcome. And then the outcome measure, ED23, is number of children demonstrating gains in school readiness in terms of social and or emotional development. And so the new work plan, the project has decided that this will work, and the new work plan has an output of 40 children's complete participation in CNCF-supported early childhood education programs, and an outcome of 34 children demonstrate gains in school readiness in terms of social and or emotional development. So moving on, we've reviewed 2 work plans, and we learned that the first work plan and after-school mentoring can fit into K through 12 education with some adaptations, and they have 55 unduplicated volunteers serving in this area. And the Smart Start work plan was also adapted to fit within early childhood education with 20 unduplicated volunteers. So let's see what this looks like percentage-wise. The project's primary focus area can be education. The project's total number of unduplicated volunteers is 185. And remember, we're only counting unduplicated volunteers, meaning you cannot include a volunteer in more than one work plan. In between after-school mentoring and Smart Start, there are 75 unduplicated volunteers in education, or 40% of the project. This meets the 25% requirement for a primary focus area. The project has reviewed the instructions and determined that 30% of their volunteers are serving in community priorities. And using the instructions, they also reviewed the rest of their work plan and decided that the remaining stations can fit measures in the other focus areas and capacity building. So now that we've reviewed education, I would like to pause for some more questions. And we have plenty of time for questions, so please submit them through the green Q&A button on the left-hand side of your screen.
Okay, and again, one general question that has come up quite a bit is where people can find the RSVP NOFO.
Okay, it should be available now on the Senior Corps website, but hopefully we have a link somewhere in this conference. I will follow up on that and post a note in the forum. So please come back and review the forum, which, again, you can access on the left-hand side of your screen under Content.
That was also a question that has come up, where the forum is, how people can access the forum. And also, is there a sample sheet with definitions, and if that can be placed in the forum as well?
Okay, I'll see if we can add files. I'm not certain about the platform, but it is in the definitions that we've reviewed today are all included in the RSVP NOFO Appendix B. So you will have access to all of these definitions to help kind of look at your project plans and activities you're doing and help them align.
So it has been noted that during a performance measurement overview recently, the information was given that 30% of volunteers needed to be in the primary focus area and 25 can be in community priority areas. However, this presentation seemed to switch that. Can you explain a little bit about that?
Sure, good question. Yes, this actually did change. So originally, earlier this summer, before they kind of, I don't think everything is completely final yet, but they did the switch. So originally it was that 30% had to be in a focus area and only 25% were going to be in community priorities. But based on, they got a lot of feedback from the field in determining these measures, and it was determined that it would be better to have 25% in the primary focus area and enable projects to include up to 30% in community priorities.
Okay. Another question is, will one school year meet the definition for the education work plan areas, as a school year is generally 9 months?
Yes. So the program basically determines at the outset what completion of the activity will look like, or completion in the program will look like, and then they will count the students or the children that participated fully in the program.
All right, and going back to the beginning of our presentation, Does homebound, can you explain a little bit more about homebound? Does homebound mean an individual can't leave the home or has limited capacity to leave?
Limited capacity. So let's review the definition. Forgive me, I want to make sure I quote it exactly. Just give me a second. Homebound is defined as individuals unable to leave their personal residence due to disability, injury, or age, may be a short-term or long-term need. For example, an individual may have a broken hip that prevents them from driving for a few months, but after the injury has healed, they no longer require help to live independently. Could you repeat the question real quickly, Tara, so I can explore that some more?
Sure. The question was to define homebound. Does that mean limited access, or such as uses a walker, or maybe can't drive? So it was basically a review of the definition.
Okay, yeah. I mean, I think that it makes sense if whatever impairment they have limits their ability to live independently. In other words, if they couldn't live independently without some assistance, then I think that would define it. Meet the definition as homebound.
Great, thank you. And what work plans or what focus area would pertain to individuals who are not homebound?
The individuals that are not homebound. There is, I think it would depend on what the activity is. So I'm trying to think what exactly the question is getting at. But there are, I mean, for Healthy Futures, the focus really that we explored here was independent living. So obviously you probably wouldn't fit something in there. Now you could explore the definitions within respite care and see if there's anything that would fit there. But again, I think homebound would be involved there. But there may be services you're providing that fit within another focus area, but it just depends on the activity that you're referring to.
Thank you. We do have time for a few more questions. Regarding food security, can you have a household of one?
Yes. In fact, food security is actually counting each individual in the household.
And regarding numbers served, if RSVP volunteers are serving alongside other volunteers at a site, how would you determine the best way to show results on the percentage of total volunteers?
Okay. I think one recommendation I have is to review the data collection module, which I think is available on demand. And there should be a forum in there where you can also ask questions. I think that's a better question for data collection. But what I'm trying to clarify is the term percentages. So again, we are tracking number of people served, not percentages in these new measures.
Thank you. Can a client be counted in the outcome if they are served by an RSVP volunteer who is counted in a different focus area but also serves in this area?
No. So you're going to be including each volunteer only once and reporting on that volunteer in only one work plan.
Okay. For corporation-supported early childhood education programs, the definition says that grantees do not provide direct service, but their activities must provide direct service that makes the program possible. Could you discuss what kinds of activities can be included in direct support?
So that definition is a little tricky. So I would like to explore that in the forum. So I'll follow up with that if you can revisit the forum over the next couple of days. And feel free to enter it in there as well. But I'm going to be going through and the questions that have been submitted during this presentation and exploring them a little bit deeper so I can give the best possible answer.
And we just have time for a couple more. Can you have 2 work plans for Healthy Futures?
Yes. You could have multiple work plans within the focus areas. So if you, for example, we explored we explored community gardens and also decided that the bone builders exercise would work within Healthy Futures. So those would be two separate work plans that help the project reach the 25% of a primary focus area. And you can also do that with other focus areas too. You could have a couple in veterans, a couple in capacity building. You can have more than one work plan in a focus area.
And is 6 the most work plans that a project can have?
No. So once again, a program can have more than one work plan in any focus area. So it's not limited to just one per focus area. You don't have to address every single focus area. Again, you've got your 25% that you obtain through work plans that fit within the measures, but you can have more than one work plan under each measure.
One more question. Would programs that offer medication assistance and provide tools to clients to obtain free or discounted medications fall into any of the work plans we've discussed today?
Most likely, yes. So obviously there's probably some definitions that they need to explore. But yeah, because part of Healthy Futures is increasing access to care. So under that measure, they should be able to find a way to fit it. I mean, again, depending on certain definitions and who they're serving.
And Emily, if you could just once again clarify that the total number of volunteers which need to be in the primary focus area as well as community priorities.
Okay, so once again, you're only counting volunteers in one work plan and you're only counting them once. So the entire project plan, if you have 100 volunteers, only 100 volunteers should show up and when you total up all of the work plans. And so based on that, at least 25% of those volunteers need to be in a primary focus area that you choose. And then up to 30% may be in community priorities, but it can be less than that. And then the remainder of your volunteers will need to be represented in the other focus areas and capacity building. And I want to follow up to the question on medicine and healthcare access. I do want to note that there is Measure H2, which is the number of clients to whom information on health insurance, healthcare access, and health benefits programs is delivered. And so I would recommend that the program explore using the performance measure instructions, which again are in Appendix B of the NOFO. Definitely explore that Measure H2.
And once again, just to review where this information can be found in the forums and how people can print and download these presentations.
Okay. The forums are located, if you look at the bottom left-hand side of your screen near the Q&A, there is a button that should say Content. If you click on that, you have options, and one is Files, and that is where you can access this PowerPoint. And then there is also the forum, which is where we will be following up on some questions and where you can submit additional questions, and even attendees can chat amongst themselves in the forum.
Okay, and I think that would be the last question for now.
Okay, great. Well, once again, I'd like to thank everybody for your participation and very thoughtful questions. And I look forward to getting into the forum and kind of going through and trying to answer questions in more detail or refer you to where you might be able to find the answer. So thank you for your participation, and we hope you enjoy the rest of the conference.